Let's jump right into this explainer. Today, we're tracing the path of cystic fibrosis, an autosomal recessive condition. We're going to start at the absolute microscopic origins, literally looking at tiny, almost imperceptible missteps inside our cells, and then follow that thread all the way to the groundbreaking modern treatments that are completely changing the natural history of this disease today. Seriously, it's a story of incredible scientific detective work and human resilience.
Think about this for a second. How exactly does one missing microscopic building block change the entire human body? It's a classic example of the biological butterfly effect. You know the idea that a butterfly flapping its wings can cause a hurricane across the globe? Well, in human genetics, a single microscopic error in our DNA can cascade into these massive systemic and life-altering impacts. Over the next few minutes, we're going to unpack exactly how that happens.
Section 1. A microscopic error. Okay, let's dive right into this root cause. Now, while scientists have identified thousands of different mutations across 6 different classes that can cause cystic fibrosis, an overwhelming 90% of patients share the exact same mutation. It's known as the deletion of phenylalanine 508, or just F508del for short. Nearly all the cascading effects we're about to explore, they stem from this one missing building block in the genetic code.
So, what does that missing building block actually do? Well, it basically ruins the blueprint for an absolutely crucial protein called CFTR, which stands for the cystic fibrosis transmembrane conductance regulator. Think of this protein as a highly specialized cellular gatekeeper. It's an anion channel located right on the surface, the outer apical plasma membrane of our epithelial cells. Its main gig is to regulate the flow of fluids and the composition of exocrine secretions. When the blueprint is perfect, the gates open and close naturally, keeping everything flowing smoothly. But when that blueprint is flawed, things go disastrously wrong.
Let's actually walk through how that failure plays out step by step. Because of that F508del mutation we just talked about, the CFTR protein actually misfolds while it's still being built inside the cell's endoplasmic reticulum. It's basically constructed with the wrong shape. Then, the cell's own quality control department, the ubiquitin proteasome system, recognizes that the protein is deformed and destroys it prematurely. It completely trashes the protein before it can even reach the cell surface to do its job. The result? A massive cellular traffic jam. Without that gatekeeper there to regulate fluid, the body's secretions become hyperviscous. We're talking incredibly thick, sticky mucus that begins to obstruct the exocrine glands.
Section 2. The system-wide ripple effect. Because unfortunately, this microscopic traffic jam doesn't stay microscopic for long. It actually cascades into a systemic multi-organ condition. It's not just a lung disease. It strikes the pulmonary system with thick mucus and infection. It impacts the pancreatic and GI systems, causing major malabsorption. It hits the hepatobiliary system, where obstruction of the intrahepatic bile ducts can lead to focal biliary fibrosis, steatosis, fatty liver, and even progressive cirrhosis in roughly 4 to 15% of adults. And profoundly, it impacts the reproductive system. In fact, approximately 99% of males with CF are infertile. This is due to the complete involution or shrinking away of the vas deferens even though they have totally normal spermatogenesis. Women also face reduced fertility due to abnormal reproductive tract secretions.
But let's zoom in on those pulmonary impacts for a second, because this is where the disease takes a truly tremendous toll. The airways face an aggressive, unrelenting neutrophilic inflammatory response. Because that incredibly thick mucus impairs normal clearance, it effectively becomes a trap. It traps multi-drug-resistant pathogens like Pseudomonas aeruginosa and Staphylococcus aureus, leading to chronic bacterial colonization. Over time, this vicious cycle of constant infection and inflammation leads to progressive airway remodeling and a condition called bronchiectasis, where the airways become permanently widened and scarred. It even causes physical signs you can spot with the naked eye, like digital clubbing, which is a distinct swelling at the ends of the fingers.
So the lungs take a major hit, right? But fascinatingly, the disease was actually originally named cystic fibrosis of the pancreas. That thick mucus causes profound destruction of the exocrine pancreas, leading to fibrotic scarring, cyst formation, and fatty replacement. Because the pancreas just can't release the enzymes needed to digest food, patients suffer from severe malabsorption, steatorrhea, and a failure to thrive. On top of all that, because the pancreas gets so heavily damaged over time, more than 30% of adults with CF end up developing CF-related diabetes mellitus.
Section 3. Catching the condition. With symptoms so severe and widespread, the next logical question is, how do we identify it?
Historically, doctors essentially had to wait for the grim reality of severe childhood symptoms to manifest. They were looking for a classic triad: a chronic productive cough, severe malabsorption, and a failure to thrive. But today,
Our medical approach has shifted dramatically to be incredibly proactive. Most cases are now diagnosed through universal newborn screening. Before a baby ever shows a single severe symptom, doctors can confirm the diagnosis by looking for characteristic clinical markers combined with either sweat electrolyte measurements or DNA testing to pinpoint those two disease-causing variants.
Section 4, Transforming the Treatment. Let's move to our final and undeniably most hopeful chapter, disease management.
The absolute breakthrough hero of our story here is highly effective modulator therapy, or HMT. This is a massive leap forward. Remember how we talked about that F508del mutation causing the protein to misfold and get destroyed? Well, these small molecule drugs, medications like ivacaftor, tezacaftor, and elexacaftor, actually go right into the cell and protect that misfolded CFTR protein from being degraded. Not only do they save it from the cellular trash can, but they also enhance its function once it reaches the cell surface. For patients with amenable mutations, these therapies have completely transformed the natural history of the disease right at the microscopic level. It's practically magic. But even with these miracle drugs, managing cystic fibrosis requires a relentless, rigorous, daily arsenal just to clear those pulmonary traffic jams and support the body. Standard care involves intense daily bronchial hygiene. Patients inhale aerosolized recombinant DNase, which literally degrades the viscous strands of DNA trapped in their mucus. They use nebulized hypertonic saline to mobilize secretions, and they undergo mechanical chest physiotherapy. Plus, they rely on targeted aerosolized and intravenous antibiotics to suppress those chronic infections, alongside taking pancreatic enzymes and fat-soluble vitamins with every single meal just to process their food. It is an intense, daily commitment to survival.
And for those facing the absolute most severe pulmonary progression, where the lung tissue becomes completely compromised, medical science does offer one final vital lifeline. For end-stage CF pulmonary failure, a bilateral lung transplant is a highly viable option. By replacing the severely scarred lungs, patients can gain substantial life-extending benefits, with a median survival of over 9 years in adults post-transplant.
So the crucial point to take away from all this is that because of early detection, daily management arsenals, lung transplants, and most importantly, the revolution of highly effective modulator therapies, the entire narrative of cystic fibrosis has fundamentally shifted. Advances in treatments have significantly extended the lifespan of patients, taking a disease that once tragically claimed lives in early childhood and turning it into a manageable condition where patients often live into their 5th decade and well beyond.
We started with a microscopic genetic error, a single deleted building block, and traced it all the way to therapies that are literally giving people their futures back. By unlocking the mystery of the CFTR protein, we've changed the world for thousands. But it leaves us with an incredibly exciting thought to ponder as we wrap up this explainer. If we can correct a single molecular misstep and reverse a systemic disease like cystic fibrosis, what other profound genetic mysteries are we currently on the absolute brink of solving? Thanks for diving into this with me.